Hi guys, today we're going to talk about chapter 19, and so I'll go ahead and share my screen here with you guys. Okay, so this topic is genetic development, childhood and mental health diseases and disorders. So when we're talking about children and development, we need to talk a little bit about chromosomes. There are 23 pairs. Typically, we have 46 chromosomes. They divide, they double, then they divide, and then the germ cells or the sex cells reproduce through meiosis, and haploid cells carry 23 chromosomes. Now, you don't really need to know about haploid cells and all that, but just know that we have 23, typically we have 23 pairs. In normal females, there is an XX chromosome, and in the males, there's an XY. It is the male sperm that determines the sex of the child, and because they carry either an X or a Y. Chromosomes can be visualized by karyotyping, and sex chromosomes can be evaluated by a buccal smear. Excuse me. Female X germ cells are much larger than the male Y cell and carry more genetic information. Chromosomes are made of DNA, and they are in a specific order, and each one is called a gene. And so they get one, children get one from each parent, and they pair up during fertilization, and the paired genes are called alleles. You don't necessarily need to know that. Each gene in an allele can be dominant or recessive, and homozygous mean matched alleles such as big B, or little b, and heterozygous are unmatched alleles such as big B, little b. And so this is kind of hard to explain in an online lecture, but you can look it up. It's actually pretty interesting. This is how we decide if people will get certain disease states. We don't decide, but we can figure out if they're going to. Abnormalities can be due to a chromosomal disorder, a genetic disorder, environmental factors, or a combination of any of those things. And they acquire abnormal genes in two ways: a mutation of the gene during meiosis or the hereditary component of that. They're passed to offspring in four ways. Good grief, my button keeps moving. Autosomal dominant, autosomal recessive, sex-linked dominant, or sex-linked recessive. And 2% of newborns are born with a congenital anomaly, and they don't really know why a lot of them have it, but 20% is believed to be genetic. They can do fetal ultrasounds, they can test amniotic fluid, maternal blood, and even since this book has been written, there are a lot of changes in how they're doing diagnostic tests, and now they can apparently look at genes ahead of time and make sure that children don't have certain diseases. Muscular dystrophy is a genetic degeneration or weakening of the muscles. It's also called Duchenne's muscular dystrophy. That's the most common type. It is a sex-linked disorder passed from mother to son. The onset is between 2 and 5 years of age, and they're going to have a waddling gait. They're going to walk on their toes. Lordosis is just kind of a humped over appearance. There is no cure, and they're going to have physical therapy or orthopedic devices, and exercise is helpful. Congenital hip dislocation is an abnormal hip joint resulting in femoral head slipping out of the normal position. This is improper positioning in the uterus, sometimes due to maternal hormones. And you can see there the different symptoms that they're going to have, and they're going to have to do surgery. Clubfoot. This was more common, I think, years ago, although I still have heard of it. You just don't hear it as much anymore, I don't think. But it is a common congenital abnormality of the foot, and it may be because they repair it when they're so very young that you don't see it. Years ago, they didn't repair it, but the foot or feet are turned inward with toes pointing down and the heel is drawn up. And they're going to do gradual straightening, cast, splint, sometimes surgery. Hydrocephalus is a neurological disorder, and it is an abnormal accumulation of cerebrospinal fluid in the brain. It's usually due to an obstruction, and it could be an infection, a tumor, a congenital defect. I've actually seen this. So I feel like it's relatively common, but they're going to have rapid enlargement of the head and bulging eyes, tight scalp, high-pitched cry, and they're going to put a shunt in, and these children will be fine. Microcephaly is a condition where the head is smaller in circumference and the brain isn't fully developed or stopped growing. And this is a pretty sad thing. And I don't know if you guys heard of that Zika virus, but the Zika virus by mosquitoes has been linked to microcephaly, and these children are going to be impaired and have disabilities. Cerebral palsy is a congenital bilateral paralysis. It's caused by inadequate blood or oxygen during their development, birthing process, or infancy. There are some lawsuits out there about this because if they feel like it's due to the fault of the physician who is delivering. I don't know if that's necessarily the case, but these babies will have muscle weakness. They will have rapid muscle contraction. It's kind of a sad thing. They're going to do therapies, they're going to treat it, but there is no cure. Spina bifida, this is a congenital disorder. It's an opening in the spinal column. They don't know why it happens to some, but they think that it could be due to a virus or genetic factors. And there are, with symptoms with this, I feel like it varies because I've seen a few cases of spina bifida, one that was not severe at all, and then another where the child couldn't even walk. So I feel like it's varies in severity, and they're going to have surgery, and they're probably going to have several surgeries. Huntington's disease, this is a genetic defect of chromosome 4. This is genetic. If one parent has the disorder, there's a 50% chance that they're going to pass it on to their offspring. They're going to have behavioral changes, unsteady gait, increasing dementia. There is no cure. There are some medications to reduce the symptoms, but these people are going to pass away. Usually by the time they figure out that they have it, they've already had children. And so then they've likely passed it on to their children. It is a sad disorder because these people eventually can't remember anything. And so congenital heart defects, these are heart-related vessels or most common sites of congenital defects. And they can range from small to quite large. I have seen a few children who have this, and there are lots of people walking around as adults who have had a congenital heart defect, and some who have it and don't know it. Usually when you hear about people suddenly passing away on like a basketball court in their late teens or early 20s or on a football field, usually that's due to a congenital heart, it's not always, but due to a congenital heart defect that nobody knew about. Causes unknown, symptoms can vary. They're going to diagnose it by an electrocardiogram and a physical examination. You want to diagnose it early so that you can detect it and correct it. There are some digestive disorders that can range from mild to severe, but many are diagnosed at birth, and some are incompatible with life and they have to do surgery immediately. Sometimes they can do in utero surgery on some of these types of things. And there are, like I said, several different things that can occur. They don't really know why they occur, but smoking, alcoholism can play a factor. Cleft lip is fairly common. It's one or more splits in the upper lip. It affects boys more frequently than girls, but ironically, I know a man and a lady who have this, and they're going to do surgical repair. Cleft palate is more serious than a cleft lip. This involves the roof of the mouth, and they're going to do surgery to repair that also because that baby will not be able to eat. There's a cleft lip and a cleft palate, and as you can see, that goes all the way, that's not just the lip, that goes all the way through the roof of the mouth. There's a cleft lip and palate. All right, pyloric stenosis is a narrowing of the lower end of the stomach. This is a common anomaly of the digestive tract, and they're going to have projectile vomiting. I actually had this as a child. And this is just showing you that hypertrophic pyloric muscle. It's just not developed yet. And so it's that little muscle there is underdeveloped, and so those babies puke up all their food. Hirschsprung's disease is an absence of the nerves in the segment of the colon, usually part of the sigmoid colon, if you guys know where that's at. They're going to have chronic constipation and abdominal distension, and they're going to have surgery. They may have to have a colostomy too. PKU is a genetic disorder that involves the faulty metabolism of the protein phenylalanine. This is diagnosed by blood test 72 hours after birth. It is mandatory in the United States because lack of treatment can result in mental disability. So these kiddos have to be on a special diet. Now, think about people who are choosing these home births, that choose not to vaccinate, and they're not getting their kids to the doctor. They're not getting these tests done. So unfortunately, I think we'll still see some of this, which is completely curable or completely treatable by diet. So it's unfortunate. Hypospadias is an abnormal congenital opening of the male urinary meatus or under the surface of the penis. So essentially the opening for both of these is not where it should be. So sometimes most of the time I think that they repair it surgically. Wilms tumor is the most common solid tumor that affects children and infants. It's thought to be genetic, highly malignant, usually replaces one whole kidney, and they can be asymptomatic, meaning they have no symptoms until it's large enough to feel in their stomach, and they're going to have chemotherapy and surgery. Autism, I don't know who isn't familiar with autism at this point, but if you don't know of somebody who has this, then that's good. Although I feel like some of the kiddos who have this are just the sweetest kiddos. My son has a high form of autism, and it can be hard, but I still feel like a lot of these kiddos are treated poorly, and even in the schools, but they're great kids. So this is a developmental disorder characterized by difficulty communicating and forming relationships. They don't know why. There are some people who think still that they're linked to vaccinations, even though the gentleman who wrote that initial paper says that recanted that. But these kiddos will sometimes have a blank facial expression. They're going to be more involved with themselves, inaccessible to others, and there is treatment. But some of these kiddos, I had a patient who was severe autism, and it was very, very difficult as he got bigger, when they're smaller and they have these temper tantrums and things like that because they don't understand quite everything that's going on. It's easier to control when they're little, but I had a patient who was 17, and he was 5'10" and 220 pounds, and his mom was this small lady, and when he would get in these meltdown modes, it was very, very hard for her to handle, and he would sometimes become violent with her. So they ended up moving, and I don't know what happened to them, but I often worry about her, thinking what in the world happened, because as parents age and these people with severe autism, I'm not for sure what will happen with him. Stuttering. This is a developmental speech disorder. It often occurs when children address an impatient or angry parent. It's a hesitancy of starting and finishing words or prolonged pauses, and they can do behavior modification and positive reinforcement. Cystic fibrosis is a hereditary disorder. It's a recessive disorder and affects all exocrine glands, leading to viscous. And essentially what that means is they're thick. Viscous means like thick secretions. And they're going to do postural drainage, chest clapping, antibiotics, bronchodilators, expectorants, oxygen. They even have like a little jacket that they put on them that kind of will do all of that. It kind of squeezes their chest, hits their chest to get that stuff out of there. Down syndrome. This is also called trisomy 21. Again, this is some of the sweetest kids I've met or encountered have had Down syndrome, and some of the hardest to deal with. So I think it varies based on kiddo and what they grow up in, but just a sweet, sweet spirit in some of the ones that I've known. A condition of having 3 chromosomes instead of the normal 2 in the 21st position. Symptoms, again, can be mild to severe. They're going to have facial features that are different, and treatment's going to be, again, highly individualized. This is something we see in some of the infants that we deal with our patients. I had a patient a few years ago, actually more than a few years ago, and she had schizophrenia, and she ended up getting pregnant and had a baby, and the baby ended up with failure to thrive, got taken away. It was kind of a sad, sad thing, but the baby was so small. They're going to be really, really small kiddos. They're going to be irritable. They're going to not gain weight, and they're going to kind of be limp. They're not going to have a lot going on, and it's usually just a disturbance in the mother-child relationship. Older kids can have this too. This doesn't necessarily apply just to infants. And it can be an unresponsiveness to affection, avoidance of eye contact, stiffening when cuddled, and then treatment's going to just be teaching that mom to nurture that child and promote self-esteem. Fetal alcohol syndrome is a group of symptoms and birth defects in an infant born to a mother who consumed alcohol during pregnancy. There is a certain stage in pregnancy, I think, when this is higher risk. I can't remember exactly what it is, but there are varying degrees of mental disability, and they do have some facial features that are a little bit different. And that's all on that one. Let me know if you guys have any questions, and I'd be happy to answer those. I think it's a pretty straightforward chapter. And I, again, will post, this is the only new information that is going to be covered on your final, and so I will post a study guide so you guys know where to focus your attention.